The urinary bladder is a muscular organ that lies anterior to the pelvic region. In the external features, we have the apex, the base, and the neck. In the borders, we have the anterior border, the posterior border, and two lateral borders. And the surfaces include the superior surface and the two inferolateral surfaces. Relations of the urinary bladder. The apex, we have the medial umbilical ligament that joins the umbilicus. At the base, in males, there is rectovesical pouch. In females, the cervix and the vagina. At the level of the neck, in males, the prostatic urethra. In the females, the pelvic fascia. And the superior surface in males, the peritoneum, and the females, uterus. Ligaments of the urinary bladder. We have the true ligaments and the false ligaments. In the true ligaments, we have lateral true ligament, posterior ligament, median umbilical ligament, medial and lateral puboprostatic ligament. In the false ligaments, there is median umbilical fold, medial umbilical fold, lateral false ligament, and the posterior false ligament. Interior of the urinary bladder. In an empty bladder, the mucosa shows irregular folds due to loose attachment, but at the base of the bladder, the mucosa is attached firmly and it is smooth. This area is called as the trigone. The uterus opens into posterior angle of the trigone. The slight elevation on the trigone is called as the uvula vesicae. The base of the trigone is formed by the bar of Mercier. This bar of Mercier extends beyond the ureteric openings to form the uteric folds. Capacity of the bladder is 120 to 320 ml. Beyond normal values, there is an urge to micturate. Beyond 500 ml, it becomes painful. Blood supply of the urinary bladder is by the superior and the inferior vesical arteries and the internal iliac artery. Venous drainage is in the internal iliac veins. Lymphatic drainage, it drains into the external iliac nodes. Nerve supply is by the sympathetic nerves, parasympathetic nerves, pudendal nerves, and the sensory nerves. Clinical anatomy of the urinary bladder. Cystoscope means examination of the interior part of the bladder. Hypertrophy of the bladder is seen whenever there is obstruction of the urine flow due to enlarged prostate gland. The urinary bladder is a site for stone formation. Expanded bladder may rupture due to injury to the lower abdominal wall. In suprapubic cystotomy, the bladder is filled about 300 ml of fluid. The anterior part of the bladder comes in direct contact with the anterior abdominal wall to drain the urine without entering the peritoneum. Microscopic structure of the unstretched urinary bladder. The mucosal folds are made up of transitional epithelium. It consists of 4 to 6 layers of the columnar or the basal cells and superficial dome-shaped cells, where some cells are binucleated. The lamina propria has blood vessels and nerves. The musculature consists of the inner longitudinal layer, the middle circular layer, and the outer longitudinal layer.